Yeah. Thanks very much indeed, Paul. Paul and Christine have got a train to catch, so I'd like to thank them for coming. Fair enough. We've got one more speaker. Just before I ask James to speak, I think you'd like to know the collection rate is £143.76. I also understand that we've had a pledge of 163, I think. Thank you very much, Paul. We've also had a pledge of a £200 cheque from Joe Morgan from the GMB, and with Paul's £20, we very nearly made a profit tonight, but it would be horrendous if we did, because that's not what we're about. But it's a fantastic effort to help us along. The final speaker tonight is James Anthony. The fight to save the NHS is all about fight. NHS workers are going to carry that fight at a disproportionate level. James is chair of the Unison branch at the Queen Elizabeth Hospital, National Executive member, and has been promoting that fight throughout the Labour movement. James.
I think I get the raw deal going at the end, because I have to cut out all the bits of my speech that everybody else has definitely said. And I want to talk about pensions, because ultimately that's what my members are thinking about. And the reason I've got slightly baggy eyes is that I was in my workplace until 1:30 last night meeting with night workers, because we're a 24-hour service and it's a 24-hour strike. But I want to talk a bit about why pensions are so important to health workers, because this is historic. This is the first time in the 63-year history of the National Health Service that we've had a national strike in the health service. We had widespread industrial action before, we had widespread industrial action in the late 80s over pay and grading, but this is the first time ever in the National Health Service history that we've had a full national strike. And that's because it's very reluctant that health workers take this action. I'm a staff nurse and work on the wards, and I wouldn't take action lightly that would leave patients without nurses. And that's a big thing. But for health workers, pensions are important because we've never been well paid. As professionals, we're not as well paid as a lot of the other professional groups in the public sector. But people have always said to me, as I think Graham said, no one does it for the pay, and no one does it for the pension. But they think, well, at least I'll get looked after in my old age. We spend our life looking after the elderly of today. At least when we get there, we won't be the people that we see when we visit people in their homes, scraping by to just get on. We won't be the people that we see come into hospital because they've not been able to put the heating on because they're worried about their fuel bill. But actually we'll be looked after because of what we've done. And there's a big impact for health workers. I get, currently, unless these changes come through, I actually get to retire at 60. And many nurses, particularly people in mental health, get to retire at 55. And they've been told in one go that that's going to change from 55 to 65, and for some of us, luckier younger ones, to 68. It's a massive change to bring to people. And it's a huge issue. And this actually completely rips up a deal that health workers have been doing. One of the reasons it's been confusing for a lot of health staff is literally in this summer, we've asked our staff to choose between the scheme that they were already in or the scheme that we renegotiated for them, which came in 2008. Because I have to say I negotiated did a very good job of that, and there were some people that will be better off in the scheme that we renegotiated. So they think that they signed a form that says they're staying in their old scheme, which means they get to retire at 60. And what a shock when we go around as the union and say, no, actually, all that stuff in the press about retiring later, that affects you as well. And there's a lot of anger out there. And that's why we got the ballot result that we did. In Unison, 82% of our members that voted in the health service voted yes to action. That was astronomical. A higher result than in local government, which shocked most of us because we've never been in this situation and we didn't expect that at all. And the turnout was disappointing. It was particularly low in England, partly because of that exercise where people think they've already done something with their pensions, so they didn't think they needed to do it again. But I won't have anyone attack this action as being illegitimate. And I certainly won't have anyone in a government that was elected by no one, with no pledges about government that could come into a coalition and promise no top-down reorganisation, and then think it's democratic to force through Parliament the biggest top-down reorganisation of the health service in its history. And I will take no lectures on democracy from them.
Yeah.
And let's put this to bed about union barons, because this really tees me off. Every time I hear anything on the news, union barons calling public sector workers on strike. Let's be clear, the people that made this decision were our members